with the future being on the horizon, AI is involved in every aspect of what we do here, not only in America, but across the entire globe. So essentially, with these shortages being projected, of course, that's 35,000 provided shortages for health centers only by 2030. AI is a necessity at this point, right? We need to use it. In some ways that health centers can use it now is to basically help with improving operational efficiency, whether that be with chatbots or whether that be with helping customers explain or input their inquiries regarding simple information, or just how the actual health center operates on its own, right? This stuff can come in and help them to save time. So with North Central, we help them with the chatbots. We help them with using AI to improve their marketing strategies and whatnot, right? Making sure they're impacting the right people, the right parts of their community to make sure they get the most the customers to come in. So there's various ways that health centers around the nation can use AI to help improve their operations and further just soften that blow that everybody's going to experience here over the next couple of years, if they're not already experiencing it when it comes to the current workforce dynamics here in the U.S. So that's what I just wanted to add. Again, if you guys want to add anything, please do.
You want to add some, Jada?
No, I think he pretty much broke it down well. Of course, I would say as well as what we help them with, also things that they do with their patients. So patient level data, of course, AI can come in and help with that, analyzing medical images, things of those sorts. So I think that it is important for these health centers to start adopting AI as soon as possible due to these workforce cuts as well as Medicaid cuts that we're seeing upcoming.
I just think so. This is our 7th podcast, and the key thing that I think makes it different than prior podcasts is now we're talking about the work that we do with data. And I want this episode to really serve as an example of how, I always preach about looking at the other side of the coin, looking at this silver lining. And I think sometimes when things are perceived to be unfavorable in our lives, such as losing money, or in this case, we see the federal government making cuts to certain programs, some people might take offense to that. Some people might be offended by cuts being made. Where I see things happening is that I think that should incite in each of us whenever something happens that we don't think should be happening or that we think might pose a challenge. I think that should make us just rise up to that challenge and look at the other side of the coin.
Yep.
And what we do here at SaNDAI is we've identified the other side of the coin, okay, in all these opportunities. We've looked at the Medicaid piece, what effect it's going to have on health centers. That's going to be real. Health centers are going to close. More efficient health centers are going to be asked to do more with less. Health centers are going to need to find ways to make money, same way as people. All right, they have to find alternative ways to make money. They're going to have to find alternative ways to serve their patients, deliver this high quality service that every CEO or CFO or leadership person at a health center wants to do. I think for us as individuals, though, the advent of AI gives us a tremendous opportunity to be more than just us, to think more than just about ourselves. All right. And I think what we do again at SaNDAI is we take these technologies and we're always listening to what our customers' needs are. We look at what the landscape is dictating for our customers. And this landscape is dictating for our customers as the FQAC customers we have, the urgency to think more broadly, to be curious, to be more exploratory, to try to find alternative ways to do what they do each day. Before I conclude, I want to talk a little bit about background. I think of podcast number 4, I had my brother come in and we talked about the importance of family and data. And there are always things in our lives that happen to where we are closing a circle, if you will. This episode I would like to dedicate to my cousin. Her name was Monique. I'm not going to give her last name. She's an much older cousin than I was. I mean, my brother and I were raised by her to some degree because she was raised along with our mom. And we grew up actually thinking she was our auntie. We would call her auntie, okay? We didn't know until we got like maybe 10 or 11 that she was really our cousin. But this young lady, Monique, personified what it meant to not let something hold you down. Now, I didn't know this, okay? 10-year-old, I always say this word, snotty nose, but 10-year-old kid, you just know what you know, and you're not necessarily looking to gain much information day to day from what you see. But she spent considerable amounts of time with us as kids. I mean, I can just remember her taking us to parks, movies, fairs, By the time my mom or my dad, their time was occupied, she would spend time taking us there to these different events. I can't think of all of the events right now because obviously my mind is drawing a blank, but I just think of favorable thoughts when I think of Monique, okay? What I didn't know until I got much older is that she had sickle cell disease. I just knew that she was always in the hospital, just once a month, at least mentally. And in my mind, I would say, she's in there again? Because I'm a kid. I didn't know what that information was telling me. I didn't know the significance of that. 19 years old. I've worked out for the last 30 years. I can't think of more than maybe 2 months that have gone by in the last 30 years that I didn't go to the gym. So the gym, to me, working out is a huge part of my lifestyle. It's embedded into me. If I don't work out, I can't function. I probably prefer to work out more than I prefer to eat. And it's helped me maintain a fairly healthy lifestyle. But the person who got me in the gym was Monique. Now, again, I think one of you guys just said something about a person not being able to exercise really intensely with sickle cell disease. That wasn't Monique. And she worked out hard, man. She worked out hard for the time her body allowed her to. Of course, she was younger back in those days, but I just remember her always doing legs. If you know something about a lot of us, man, we hate doing our legs. Yeah. Monique is always doing her legs. But she got us in the gym. Now, of course, we didn't do leg day with her. We didn't do leg day with her. But she got me and Jeffrey in the gym. Okay? And I almost feel like it's yesterday. I can remember her getting us in there. And she logged us in. I think she paid for us to work out for like 2 months. And that has become a major part of me. So I talk about this full circle stuff, right? This full circle, this sickle cell disease, right? The fact that we landed on this inadvertently. This opportunity was delivered to us 2 years ago by Dale and North Central Family Medicine to come in and to do the work that we're doing. The fact that we're going to have an opportunity in October to get in front of a national audience and display our work is how I pay homage to Monique. Yeah. So deep down embedded in the work that we do every day is my focus on faith, family, and then using that to build fortune. So it goes back again to our title of this podcast, Data, Dollars, Dynasty, right? All that includes family, because faith is a part of that. And for anybody out there who's listening, I absolutely love the alphabet. So I got all these A's, B's, C's, D's, E's, and F's, where I create these formulas to success. So my D's is Data, Dollars, Dynasty. See? D plus D equals D, right? My F's are faith plus family equals fortune. Okay, so when I think about that family piece, every time I go back and I think about what the people in my life meant that I didn't necessarily give credit to, just the different downloads I got from those people, because those are my formative years. I'm talking about with Irish, or Monique, we call her Irish, but those formative years, she played a critical role in that. And then now that I get the opportunity now, as an older guy, to now go back and then attack something that took her away from us, right? Gives me extreme pleasure. The information that we shared here today, we're not doctors by any means. We're not primary care providers. We're just regular Joe Schmoes interested in making a difference. I would just leave the audience with a few concluding thoughts. Always look for that silver lining. It might not be disclosed to you immediately, but it's there. When you get up each day, look for ways to spot data that's in your life and try to use that data to, one, help yourself, but more importantly, help the people around you. We think that everybody is surrounded by data. Different data points mean different things to different people, but ultimately we see, again, the AI aspect of what the world is offering to all of us gives us the ability to do more with less. Each person has the ability now to really be passionate about causes. It just requires that you wake up and for those causes and be curious about this AI.